So it's Dr. Ryan, and today we're going to go and talk about part 2 of testosterone and long COVID, or testosterone and COVID. Last week, we looked at the review article, which reviewed many of the articles involving testosterone and coronavirus 2019 disease or COVID-19 disease. And today we're going to continue that topic. And we had stopped last time on the methods and search strategy for this particular article, right? And so, and again, last time what we had done is we had kind of talked about, this right here. We had kind of talked about this particular article, Testosterone COVID-19, Adversary, Bane, Comrade, Boon. We talked about an overview of COVID-19. We talked about what areas of the body it affected. We talked about the renin-angiotensin-aldosterone system. We talked about COVID-19, or rather SARS-CoV-2 virus binds to the ACE2 enzyme and goes to the ACE2 receptor and causes a whole bunch of sequelae owing to increased angiotensin concentrations, angiotensin 2 that is. And then we talked about the controversy of whether or not lower or higher serum levels might be better. And so, and then we've also talked about the TMP-RSS2 protein and its function in facilitating transmission of the virus intracellularly and how mRNA viruses work. And finally, long COVID and post-COVID syndrome. Okay. And so we had ended on the methods and search strategy. So let's go ahead and move on past that. And again, as we had mentioned, this article in particular looked at 20 different published articles that looked at testosterone and COVID-19 disease. And it just divided them into certain areas. So the first area that the article looked at was testosterone and acute lung injury. And so here are some of the summaries of the articles they cited. So Miller et al. In 2016 had noted that testosterone serum was reduced by aging and cardiometabolic diseases, and also dyslipidemia, heart failure, and atherosclerosis. And they established that this was a common risk factor in the development of COVID-19 severity, right? And then, they established that it was lower in these particular diseases, and these are common risk factors in the development of COVID-19 severity. There's been several studies that have illustrated that testosterone, in the prior, of course, the epidemic, that has a protective role in the respiratory system. And this Montano et al. In 2014 noted that certain respiratory mechanics, such as forced expiratory volume, vital capacity, those are, how far the lung can expand, oxygen consumption, and respiratory muscle contraction, all of those markers seem to be improved with higher testosterone levels. Pro-inflammatory cytokines, remember, these are elevated in COVID-19 and are heavily involved in the pathogenesis of acute lung injury, and ARDS are associated, obviously, with COVID-19. And testosterone appears to inhibit the production of these cytokines, in particular IL-1 beta, IL-6, TNF alpha, and inflammatory adipose cytokines. And so Bianchi in 2019 had mentioned that. So it appears that, testosterone may be beneficial in terms of acute lung injury. And here's a diagram indicating the various effects testosterone has on several white blood cells, the immune system. It seems to decrease TNF alpha and IL-6 and IL-B expression in monocytes. It increases toll-like receptor 4 in macrophages. It decreases T cell proliferation as well as lymphocyte proliferation, decreases IL-6 production by mast cells. So pretty interesting. Okay, so let's talk a little bit about testosterone and testicular injury that's associated with COVID-19. So SARS-CoV-2 obviously binds to ACE2 receptors, as we've mentioned before, and these are found in testicles. And if there is some suggestion that it can lead to cisterally and Leydig cell damage, as well with subsequent decrease of testosterone synthesis within these cells. And these are cells that are linked, of course, to testosterone production in the testes. We're not entirely sure if it's direct damage or just a local inflammatory reaction. So Yang et al. In 2020 suggested that there was a local inflammatory reaction due to the SARS-2 infection. And there's apparently a deregulation. Well, as we talked about, the renin-angiotensin system, so upregulation of angiotensin 2. So this may be linked to impairment of testosterone synthesis. And we also know, obviously, that ACE2 receptors are more expressed in the gonads, both the ovaries as well as the testicles. So this can certainly be linked to lower testosterone levels, and it appears potentially male infertility. Estevez and all in 2021 suggested this. And then Falafel in 2021 actually did an analysis of testicular biopsies in patients with COVID-19. And this particular author found that there were histopathological changes that were similar to hypoxic injury and microthrombosis. And that is something that was also noted in lung tissue. So it was particularly in individuals who had COVID-19 induced acute lung injury. So similar damage was occurring in the testicles as it was in the lungs. Testosterone and oxidative stress. So oxidative stress, let's talk a little bit about what that is. Really, what that refers to is the effect of reactive oxidative species causing oxidative stress, and basically causing, they basically are removing electrons from certain molecules and causing molecules with unpaired electrons, which can wreak havoc within the cell, right? And these reactive oxidative species can be released, they're typically released by neutrophils in terms of inflammation, but there's many things that can be linked to increase the reactive or ROS, viruses, metabolism, smoking, pollution, radiation, processed food, UV light. And antioxidants appear to reduce these. And that's why it's a good idea, to get your vitamin C in, vitamin E, coenzyme Q10, even vitamin D. And then, and of course, flavonoids. I'm a big fan of berries, and berries have a very high amount of flavonoids. Anyway, so these reactive oxidative species, which are released by neutrophils, appear to be increased in COVID-19, right? And this is a main mode in which damage occurs, owing to those increased cytokines, right? And testosterone has been shown, Marin et al. In 2010 has been shown to inhibit neutrophil oxidative stress by reducing the production of these particular species, in particular superoxide anion, and it seems to inhibit lipid peroxidation and improvement in glutathione reductase activity. So this is a particular enzyme that's useful in reducing the activity of these reactive oxygen species, right? And so we know that in COVID-19, there are higher neutrophils, there's more ROS, reactive oxygen species, right? And testosterone appears to inhibit neutrophil release of these. So in general, it could be useful in terms of patients with who have been infected with SARS-CoV-2. Again, this is just a diagram suggesting what these reactive oxygen species do. And then so lipid peroxidation is basically just damage of the lipid bilayer in the cells. And then obviously protein damage is pretty general, but proteins are found throughout the cell and those can be damaged. And then of course, DNA damage of the nucleus, this and all can occur. And of course, the damage over time can cause either apoptosis or necrosis cell death or programmed cell death. So not a good thing long term. And I urge you guys to take a look at the study. There's some great tables. This table actually talks about many of the beneficial effects. We touched upon some of these and aligns them with the studies that they cited. So things like it improves oxygenation, it improves the synthesis, inhibits the synthesis and release of IL-6, which is one of those inflammatory cytokines, suppresses NF-kappa B, another cytokine. Testosterone serum levels are reduced and correlated with COVID-19 severity and mortality. So that's, an indicator that's probably a good thing to have appropriate levels. 70% of COVID-19 patients have low testosterone at time of admission. Okay, so admitted patients obviously are sicker than patients that develop the virus or are infected with the virus, not admitted. So That's not a good thing. Testosterone inhibits oxidative stress, as we mentioned, and it appears to improve endothelial function. We didn't discuss that, but that was one of the studies that was cited here. And then this is just another diagram also from the paper that suggested some of the modalities in which SARS-CoV causes morbidity, primarily through oxidative stress, immune activation, decreased ACE2, increased angiotensin 2, increased pro-inflammatory cytokines, and then how it affects the low testosterone levels by causing testicular injury, reduction of testosterone synthesis, and then testosterone, as we know, is anti-inflammatory based upon many of these studies. So you get an increase in cytokines, decrease in anti-inflammatory cytokines, immune degradation, and you get cytokine storm, just profuse amounts of inflammation, which can worsen the disease, right, and lead to multi-organ failure. So, okay, we talked about some of the good things testosterone does, right? But what about the bad things? So we mentioned that the key bad thing was there was a study that suggested that it elevates this protein, transmembrane protease, right? Serine 2, TMPRSS2. And that, of course, is that protein that's important in facilitating entry of the SARS-CoV-2 virus into the cell via activating the spike protein to bind the ACE2 receptor. And these are some studies that have suggested that. And Dopsack and all in 2020 suggested that testosterone seems to increase the expression of this particular protein. Whereas other therapeutic modalities that we use for patients who do have COVID-19, like dexamethasone, nitric oxide, chloroquine, apparently seem to reduce TMP-RSS2. Okay, and these seem to be also effective in managing COVID-19. But there is this complicating factor, and the paper kind of mentioned this. In obesity, right, that seems to increase the expression of TMP-RSS2 and alters the an ACE2 ratio. And so in some of these articles, they didn't select out for obesity, right? And so what is weird, though, is you wouldn't think high testosterone levels would be present in the obese, because unfortunately, obesity usually tends to correlate with low circulating testosterone. Not always, but many times. And we feel that's because if you're obese, you have more adipose tissue, and adipose tissue has a lot more aromatase enzyme. Aromatase enzyme will then convert your testosterone to estrogen, right? And then obesity has been regarded as an independent risk factor for COVID-19 severity, despite low testosterone levels, right? And so they feel it's due to multiple factors, one of which, of course, is the fact that these adipokines and pro-inflammatory and cytokines are elevated in individuals who are obese, the fact that it seems to increase TMP-RSS2. And then there's a whole host of other things that obesity seems to do as well. And so here's some of the things that obesity does in relation to male infertility, which is kind of interesting. And of course, will likely reduce testosterone, right? So it can cause scrotal hyperthermia, only to increase mass. It can cause epididymitis. It can cause erectile dysfunction. It can cause obstructive sleep apnea. It can cause increased adipocytes, increased fat cells. As we talked about, it can cause more aromatization of testosterone and estradiol, and increased leptin and insulin. So that can lead to diabetes. And then the particular cytokines can actually cause sperm DNA fragmentation, which can lead to weaker sperm that's less likely to fertilize an egg, an oocyte. Okay, androgen sensitivity in COVID-19. So this is another reason why testosterone may not be good. So Wambier and all in 2020 suggested that there's a low mortality rate in prepubescents versus adult men, and it may be due to the fact that prepubescents have low androgen sensitivity. They don't seem to react as strongly to testosterone as adult men. And then whereas men with androgenic alopecia and women with polycystic ovarian syndrome, so these individuals tend to have higher androgen sensitivity, seem to be at higher risk for SARS-CoV-2 infection and COVID-19 severity. Okay, so that's another thing that may be a negative for testosterone. There were a couple other negatives beyond, about testosterone, but those are the main two right there. The fact that it may increase the TMP RSS2 protein, along with the fact that it obviously, if you're more sensitive to androgens, populations that are less sensitive seem to do better than ones that are. However, when you look at some of the overall conclusions of the paper, it seems to, again, we'll just review through it. Testosterone hormone has diverse immunological effects. It reduces B and T cell activity. So again, it has an overall immunosuppressive effect. It seems to modulate pro-inflammatory and anti-inflammatory enzymes or cytokines. It seems to help with acute lung injury and ARDS. And low testosterone seems to occur secondary to direct testicular injury by SARS-CoV-2. And that, of course, is an ominous sign in terms of morbidity and mortality with COVID-19, as evidenced by some of the research papers. We did talk about the possible harmful effect about expression of TMP RSS2, and potentially the fact that individuals that have increased androgen sensitivity tend to do worse, as evidenced by those two papers. However, the vast preponderance of and the authors mentioned this, the vast preponderance of the evidence suggests that low testosterone level is linked to COVID-19 severity. And then they also seem to realize that high inflammatory and oxidative stress burden with downregulation of ACE2 in SARS-CoV infection, so high inflammatory load, leads to testicular injury and reduction of testosterone biosynthesis. So you get this, unfortunate cycle where that low testosterone levels are bad because they appear to be pro-inflammatory, but then you have this virus which is contributing to low testosterone by attacking the ACE2 receptors within the testicles, within the gonads, and causing oxidative stress and damaging those Leydig cells and Sertoli cells. And so those are the conclusions of that particular article. Now remember, that was published back in April of 2021. Now here's some more recent articles. Here's one in March of 2022 that looked at testosterone as a biomarker at adverse clinical outcomes in SARS-CoV-2 pneumonia. And so this particular article, the researchers looked at 35 men admitted with SARS-CoV-2, and this is, of course, a bit more recent. This is March of this year. They were created 2 different hospitals and done in Italy. And they looked at the assessment of total testosterone, free testosterone, gonadotropins, and inhibin B. And what they found is that low total testosterone, low and calculated free testosterone levels were associated with adverse clinical outcomes in men admitted with SARS-CoV-2 pneumonia. And as the total testosterone and calculated free testosterone and inhibin B levels increased before discharge, short-term functional recovery of steroidogenesis and indirect improvement of sperm function could be hypothesized. So as they start to increase, the author suggested, well, hey, as you start to clear the virus, as you start to reduce the inflammation, you tend to get some recovery. Let me go over to the next article here. This is another article that was done in January this year. And so this might be kind of leading to, some of the issues with long COVID. So this is an article that looked at testosterone in patients with COVID-19. It was a 7-month cohort study. And so as opposed to this particular article, was suggested that, some patients got some recovery, functional recovery of steroidogenesis. And as they healed up, this particular article suggested that the recovery might be, prolonged, right? And so they looked at 121 men who had recovered from laboratory confirmed COVID-19 over a 7-month follow-up. And they found that more than 50% of men who had recovered from disease still had circulating testosterone levels suggested for a condition of hypogonadism. And this, of course, the authors suggested a level under 300 nanograms per deciliter, total testosterone of serum level less than 300 nanograms per deciliter. So that's not good. And in some cases, in 10% of the cases, testosterone levels decreased even further beyond that low threshold. So that's not good. And maybe this is suggesting that it can be prolonged in certain individuals. So in this, of course, in this particular cohort, it's more than 50%. So it's a large amount. And this is kind of another really interesting article. So I suspect there's going to be many more talking about post-COVID-19 condition, right? Which is that sequelae of symptoms that's somewhat nonspecific, right? And so this was a retrospective analysis, and it looked at, there was a specialized clinic, this is back in Japan, that was done for individuals who have long COVID, right? And so they looked at 39 male patients in whom, and they measured their serum-free testosterone levels, and they were, being treated for long COVID or assessed for long COVID. They found that of the 39 patients, 48.7%, 19 of them met the criteria for late onset hypogonadism. And so they typically, they utilize free testosterone less than 8.5 picograms per milliliter. And 14 of these patients were under the age of 50 years old. So although this is becoming much more and more common, ideally you would suspect the testosterone levels would kind of, be semi-okay up until like your 30s or potentially even late 40s or, and then really start to have some issues when you hit 50 and above. But quite a few of these patients were under the age of 50. So this is suggestive that perhaps, the after effects of after being affected with the COVID or SARS-CoV-2, you may still have sequelae suggesting hypogonadism, several months later. And some of this might be contributing to post-COVID or long COVID. And it's kind of interesting if you go back to what are some of the symptoms of long COVID that the CDC put out. These kind of correlate with symptoms of testicular hypofunction or hypogonadism, tiredness and fatigue, not so much difficulty breathing or shortness of breath, difficulty thinking or concentrating, that's one, dizzy, sleep issues, depression, anxiety for sure. Some patients have diarrhea and stomach issues, although that's more of an issue with their gut microbiome, and then joint or muscle pain. So some of these symptoms correlate with low testosterone. So anyway, I basically just wanted to go through this article just to kind of talk about it. I thought it was pretty interesting and talked about some of the reasons why testosterone may be beneficial in patients who have been infected with COVID, and then potentially how it may be contributing to some of the symptoms of long COVID. Obviously, this is an emerging topic, and there's lots more research to be done, but it does give some food for thought. So, and in terms of my patients, I typically recommend them to, of course, optimize their testosterone levels. And of course, in this is primarily anecdotal in my patient group. The individuals that have gotten COVID, including myself, thankfully have not been afflicted with pretty severe symptoms. When I got COVID back in 2020, it was not the most pleasant situation. It kind of felt like like just the flu for a few days, but I recovered fairly quickly. I've been on TRT for some time, and thankfully have not suffered any symptoms of post-COVID or long COVID syndrome, and thankfully neither of my patients. So, maybe if you are suffering from those symptoms, maybe testing your testosterone level and getting therapy might be a way to get out of it. So anyway, hopefully this has been helpful. You'll see the links to the articles in the video in the description below, and I'll see you guys in the next video.